Currently, I think one of the best applications of AI in preventative cardiology is the use of AI to collate large amounts of visual data. That is really useful in CT coronary angiograms. Now, you may have heard me talk about this before, CT coronary angiogram as opposed to a calcium score. The CT coronary angiogram uses contrast to image the coronary arteries, and we can actually get images of the plaque as well as the degree of stenosis. That looks at cholesterol as well as calcium. The calcium score only looks at calcium and doesn't give us an idea of stenosis. Now, the CT coronary angiogram is interpreted by a radiologist, and it gives us a range. Those can be really accurate and really useful. If we take that a step further and take that data and process this multitude of pixels from this CAT scan data, it can be very time consuming to look at it in detail. If we process that with AI and get it automated, then that large amount of data can be analyzed quickly, oftentimes in minutes to hours. What we see with the CAT scan data is the exact degree of stenosis down to the percent of the plaque. So stenosis meaning how much it narrows inside the artery. We also see the composition of that plaque. We will see the exact amount in cubic millimeters of the plaque, of the cholesterol, and then the low density non-calcified plaque. That's that last category. Low density non-calcified plaque is the dangerous inflamed plaque. When we look at a CAT scan, the things that light up really bright are the things that are really dense. That's like bone, and that's like calcium. So when we look at a plaque and we see something light up dense and we see calcium, it's easy to detect. A test like a CAC or a calcium score, that's what it's detecting. When we start looking more specifically, as the brightness goes down, the density decreases. And what that means is that we have less calcium and other types of tissue, namely cholesterol. Once we get to a certain threshold, we see even lower intensity brightness. Almost nothing, almost like a blackout. That could be really inflamed, something filled with water. Water shows up as very low density on a CAT scan, and that's what the AI is looking for. It's looking for that type of differentiation. So the lower the density, the more inflamed, the more dangerous the plaque might be. When we look at it from a pixel and pixel standpoint, that's what AI is telling us. That's what we get when we do a Clearly scan, or sometimes a HeartFlow scan. Those are the two AI-based platforms available in the US currently, more to roll out in the future. They both have their differences and assess plaque in a little bit of a different way. The way I described was what particularly Clearly does. There's others that will look at it from a more inflammatory standpoint, and that's what the future holds. The future holds AI-based processing that will give us an idea of what's more inflammatory and what's maybe more cholesterol based. The reason that's beneficial is because then it can guide us in how we treat patients with what medications. Right now, it's a bit of a shotgun approach because we haven't been able to differentiate that. And so we make our best guess with lab markers and the images, and then do follow-up images to see progress. Ultimately, in the future, with the right imaging, we may be able to see upfront what's going to be the best way to treat our patients and prevent heart disease better. I hope that answers some questions about Clearly, HeartFlow, and some of the AI-based applications in cardiac imaging.